Hi, my name is Meghan Robbins, and I am a third-year MSW student at UW-Tacoma. I'm really excited to share my capstone experience with you, and as much as I wish we could do it in person, I'm really grateful that you have clicked on this video and are getting to see and hear a little bit about my experience virtually. So my project is titled Increasing Social Worker Confidence in Navigating Pediatric End of Life. And yes, it is as depressing as it sounds, but I think super important. So this stems from my experience as an intern this last year at Mary Bridge. Mary Bridge is our county's children's hospital, and I worked primarily in the hematology oncology unit, which serves children and young adults facing a cancer diagnosis. And unfortunately, in oncology, end of life is often something that comes up. I was really excited to learn about what resources existed for these families when they are facing end of life, and unfortunately learned that there aren't a lot. So here in Pierce County, there are no pediatric-based hospice or palliative care programs. There are some in King County and I think in some other counties around the state, but specifically here in Pierce County, there are no outside resources for us to refer families facing end of life to get the extra support that they might need. Typically, hospice is a program that kind of helps provide wraparound support to families and patients as they are facing end of life. Usually involves nursing care, medical care, pain management, social work support, chaplain and spiritual support, and other services that can kind of help ease the transition to end of life. And while they exist for the adults in our county, there are no specific pediatric programs. And what I've learned is pediatric end of life is very unique and different than adult end of life. And it's something that requires extra training and specialization, and that's just something we don't have. And so that was a little bit shocking to learn that just did not exist. And so I kind of felt like as a social work student that if that program didn't exist, then I wanted to do whatever I could do in the hospital in my primary social work role to be the best social worker and support person for these families as they navigate end of life. And I just kind of didn't know how to do that. This was kind of further cemented by an experience that I had early on in my placement in which I had to face the actual death of one of my patients. And that was really difficult, not only personally, but professionally as well, feeling like I had no idea how to help or support the family as they navigated this. I walked into a conversation that I knew was going to be really hard and heavy. The doctor telling these parents that their child only had days left to live. And it was a really difficult conversation. And I was a support person there, a professional in the room, and I truly felt like I had no idea what I was even going to say to help this family. And that was a really hard feeling to have. I think as social workers, when we are faced with these such intense and intimate and sensitive experiences in families' lives, we want to feel equipped on how to do them. And I just didn't feel like I had that comfortability. I was so grateful for the social workers that I was shadowing and working with that helped me through all of that. But I wanted to do something to help further my experience and confidence in navigating these issues. And I learned through just many conversations with other social workers around the hospital that I wasn't really the only one that kind of felt this uneasiness when it came to end of life. I immediately reached out to many of the social workers that I was working with in the hospital, and I asked, okay, tell me what trainings you did to learn about this. Tell me what experience you've got. What things did you read that helped you? And all of them kind of just threw their hands in the air and were like, well, there really isn't anything. We kind of just take it day by day and figure it out as we go along the way. And that was not the answer I wanted to hear. I felt like I wished that there was something more concrete that I could study and learn to help kind of gain some confidence in this area. There weren't many trainings about this specific topic. There isn't a lot of literature about this specific topic. And so it was really kind of left me feeling lost, like I didn't know what to do to get the experience that I was hoping for in order to become confident and skilled in being able to actually help support these families. So that is really what encouraged me to create this capstone intervention and proposal. Long story short, my proposal is to create a formal training for social workers that are working in hospital settings that can kind of help to lay out some of the foundation for how to support families navigating end of life. So what I learned through my research was that the NASW, or the National Association of Social Workers, actually has standards for palliative end of life care. I did not know this before, and was really excited to find that there actually is kind of like a guidebook on how social workers can help families navigate this issue. So what I did, because I don't know about you, but sometimes standards and guidelines can be pretty vague and hard to know exactly how to implement them. So my training will be based on the NASW standards for palliative end of care, and then will be adapted to specifically fit pediatric settings, and then also be given very specific tasks on how to accomplish these standards. Um, the background, and I'll just kind of introduce you to my poster a little bit. The background is a lot of what I've talked about so far, but just little training exists for social workers. There are no specialized programs in our county, which means that if I'm working in oncology, I don't have a hospice social worker to reach out to get special consult or answer questions. So it kind of all falls on the primary social worker to make those decisions. And then what I did was able to find in the research is that the way that we support families leading up to the end of life is actually really important and critical in how these families cope following a death. So of course, I think everybody has the right to a good death, and I would want to honor and foster that no matter what the outcome is. But it is shown in research that families who receive competent support and are felt heard and are felt cared for in the hospital setting actually cope better following the loss of their child versus those families who maybe had a little bit more tumultuous or tense experiences in the hospital leading up to the death. And then the other really important factor for me wanting to propose this intervention is for the social workers themselves. As I was talking with social workers in the hospital, I could sense this feeling of guilt, maybe that they weren't sure that what they were doing was evidence-based or based in the literature because there wasn't really much to go on. And I even felt that too, walking out of that room when we had told this family that their child would die. And I walked away feeling like, did I really do everything that I could do as a social worker to help this family? The answer was maybe. The answer was also maybe not, and I just didn't know. And that was a not great feeling for me personally and professionally, to walk away from such this intense moment in this family's life and feeling like, I don't know if I did everything that I could. And those feelings, I think, can really lead to vicarious trauma and burnout in the profession. I think there's something to be said about being able to walk away from really hard work and being able to feel confident that I did everything that I could as a way to help cope with how hard our work is. And I just wasn't able to do that. And so that is a little bit of the background for this project. Like I said, it will be a training because of COVID. I proposed it be virtual, but I would love to eventually have something like this in person for social workers to attend so that they could workshop with each other and consult with each other and kind of help just to gain a little bit of a basic foundation of knowledge when it comes to this work to help provide that extra level of confidence that some social workers might need. The two outcomes that I will base my project off of are the first one is the primary one for me, but that social workers will report an increased confidence in their ability to serve families as they navigate end of life. That's kind of the immediate goal when it comes to training social workers. But of course, there's a secondary outcome that families will also receive better care as they face end of life. And so that is another outcome of this project. My final goal statement is that all medical social workers will be trained and feel confident in navigating pediatric end of life. It's a very hard topic and not everybody wants to go there, but I think it's so important. No matter what unit in the hospital you're working at, end of life is something that comes up sometimes a lot more for others, like for example, in our oncology unit or in the emergency department or our PICU. And so I would really hope that those social workers would feel motivated to attend this training and take this training and get this knowledge. But really, I think it's helpful for everybody. I really appreciate you guys sitting through this. Like I said, pediatric end of life is just not something that a lot of people want to talk about, but I think it is so important. And I really spent the last 6 months or so just completely diving into this work and countless stakeholder interviews and reading the literature and trying to attend trainings that even somewhat relate to this topic. I've spent a lot of work learning about this and creating this training, and I hope that it eventually can be useful for others. So thank you for listening.